Good afternoon. My name is Carrie Lanham, and I am a caseworker for a lady by the name of Georgia. So, Georgia is a resident of an independent living community center. She's been there for about 2 years, and recently the staff members have reported that she has missed lunch, her noon meal, several times, and on one occasion she left her front door open. And that's just not quite like Georgia. So her physical health is actually really good. So she's only on a couple medications for her blood pressure and for arthritis. So, for somebody with in that age group to only be on a couple medications, that's just remarkable. So she's in pretty good physical health. Her family does come and visits on the weekends because they live about an hour away. So usually the weekends are the only time that they can come. But the last time that they were there, Georgia's grandson, Jack, was there. And Georgia accidentally called Jack by his father's name, which is David. So the family is, kind of a little bit concern from the standpoint that she's missing meals, she left her door open, and that just isn't quite like her. So they're trying to figure out what's going on. So I have ordered the physician on staff to come and do a thorough physical exam on her to make sure that to go over her medications, make sure that there's no medicine toxicity or any type of interference with her medications, with anything else that she may be taking that's not on record. And if that comes back okay, then probably the next thing I'm going to do is I'm going to sit down and talk to Georgia and kind of get a feel for her mood. Is she having any depression, any anxiety, anything like that? At this point in time, it's difficult to be able to make an exact diagnosis because it could be several things. So once we rule out that physically she seems to be okay, with the exception, you have different types of dementia such as vascular dementia, which if she has high blood pressure and she does have any cholesterol problems, that could be something to look at. But I don't think we're going to quite jump that far yet. The DSM criteria excludes, any type of medical disorder. So we really got to make sure that we rule that out first. Dementia is a possibility. Dementia does come on slowly. And usually what happens is it then deteriorates to where their cognitive abilities are just really affect their daily life. But, right now it is kind of affecting her daily life because she's missing lunch. And that can obviously have some physical effects on her. So, the other thing with dementia is they typically start initially having problems with recent events. So that kind of fits the bill as well, too. But, with a lot of these disorders of people that are elderly, such as Alzheimer's, dementia, mild cognitive impairment, these are all things that can start off very similar. So it can be difficult to diagnose exactly what the issue is because it starts off subtle and then it kind of goes full blown. The other issue that she could be having might be a mild cognitive impairment. There isn't any, it doesn't cause any functional impairment. They have like a modest cognitive decline in one or more of their domains. It doesn't interfere with daily life. Now, with her, you could argue that if she's missing her noon meal, that is kind of interfering with her daily life. And it's not related to a medical condition. So again, it's kind of starting off the same way where they kind of are forgetful. But at this point in time, we're not sure exactly what it could be. The other condition that it could be is it could be the beginning of Alzheimer's. With Alzheimer's, the classical early symptom is they start having memory loss, and it may begin with absent mindedness and gaps in their memory. So that is kind of what she's doing. She's having periods where she is forgetting who people are. And the next stage usually is where they become is apathy, and she doesn't really have that yet. But it does concern me that because of her age and depending on her symptoms and how this progresses, Alzheimer's could be a possibility. And with Alzheimer's, you could jump and do a PET scan, which would diagnose some of the plaque on the brain. However, most insurance companies, I don't think, are going to allow us to jump to that. But that is something that we could consider down the road. So, how are we going to treat her? So, what I'm going to recommend is, we could try an antidepressant. An antidepressant has shown to help with some dementia. There's also a medication called Aricept that you could use, but no matter what medication we use, she's not going to have get any type of memory recall back. Okay. The other big thing I'm going to do is I'm going to educate the family on some of these different conditions: dementia, mild cognitive impairment, Alzheimer's, and I want to educate them and have them kind of help me out, give me some information, watch for some of the signs and symptoms, and just kind of let them know how they can interact with her to make her feel more comfortable and to help her cognitive abilities as well too, and to keep her calm down the road. The other thing is maybe some behavioral approaches would be good. I definitely think that doing some visual cues, visual reminders would really help her out. And that way, that's going to help her, if she does start to decline more, I think that's going to help alleviate some of the frustration that she might have. And then the biggest thing too is, like I said, medications aren't going to do that much. There are some medications we can try, but I really want to keep her mind and body active. So I want the staff to make sure that she is participating socially with the other residents, as well as doing some type of physical therapy, walking, some type of exercise, playing games, because we want to make sure, as we know, even in younger adults and in children, exercise is very good both for us physically and mentally. So we want to keep her physically active, which will also help her. Her not her anxiety, but her difficulty with her joints, with her arthritis. And then lastly, I think we'll do some cognitive training with her and help her to do some things that are going to keep her mind as sharp as possible. So I think we've got this pretty early, but there is a possibility and a probability that she's going to decline. But I think taking these steps, we're going to be able to keep things at bay for a while so that she can enjoy a long and fruitful life and feel good about herself and be able to interact with her family as long as possible. Thanks, and have a great day.